Well, with all the good news from vaccines, we still have to prepare for the current reality over the next couple of months as the pandemic continues. What's essentially is a field hospital is going to be returning to the Connecticut Convention Center. This is of some video from it originally being put into place back in April. Hartford HealthCare is joining forces with the state's Department of Public Health and the Connecticut National Guard to rebuild what they're calling the alternate care facility there. Again, the plan is to have the same model, the same setup as in April. 600 beds ready to go if they're needed. Hopefully they won't be needed. But the site would be staffed by Hartford HealthCare doctors and staff. And again, right now, the Connecticut National Guard working on standing that facility up. They'll continue the work tomorrow. And to talk more about the return of this site is Dr. James Cardon from Hartford HealthCare. He's the Chief Clinical Integration Officer and CEO of Integrated Care Partners. Doctor, thank you so much for joining us. Talk to us about the decision not just to rebuild it, but also to rebuild it at the convention center now. What was the thinking behind that?
Sure, Tim, and I appreciate the opportunity. As we look and see the increasing prevalence of the virus and hospitalization certainly increasing in our discussions ongoing with the state to ensure that we have the capacity to care for people as they need care, we decided that we've met a threshold to where we need to be prepared. And given that this is something you don't want to do when you absolutely need it, you want to get ahead of it. The decision was let's get it stood up and be ready to care for folks should we need it. Our desire is to, similar to what we did in the spring, have it built, but hopefully never have to care for a patient there, and to, as the safest place to care for anybody is going to be within the four walls of our regional hospitals. But the readiness and recognizing the risk was the reason for us to proceed.
Is there at least any sort of new predictions that we think this time around it will be needed? It was not needed last time.
So we do, and everybody does modeling, and we have various scenarios of worst case, best case, and then likely. Our modeling now would suggest that we can manage this within our facilities, and it's building for that potential that we can't. As we've talked about before, the best way to ensure that we don't have to use it is for people to do all of the things that we've been asking to do for some time, which is wear masks. Limit your large gatherings, washing hands, taking care of each other here in a really important way, reduces the virus, reduces the hospitalization, reduces the stress on the system.
God forbid it does need to be used. Would this be used for COVID patients, or would it be used for other people, which would in turn free up beds inside hospitals for COVID patients?
This is going to be used for COVID patients and for those deemed stable enough to be cared into a facility like this. It's going to have certain requirements, and generally we think about people who are recovering but not yet ready to be able to return back to their home or the skilled nursing facility where they still need a few more days of ongoing therapy. Those who are stable enough in the hospital, not needing ICUs and other things for us to care for them. And we will be using the same clinical criteria we developed in the spring to manage this. So we are very much replicating the work that was done, which helps quite a bit. We've got a playbook around this, and the preparatory stuff we put together can be reused here to make sure that we're not having to reduplicate the work, which accelerates our ability to get it stood up.
One last quick question, Doctor. Does the fact that this is being put in a giant space, open space, knowing what we now know about the necessity of airflow to stop the virus from transmitting, does that sort of work in this field hospital's favor?
It does. You've got good space. Everybody, obviously, all patients will be COVID positive, and we have plenty of the personal protection equipment and other things we need to make sure that the staff who's caring for these folks are safe.
Hey, Doctor, thank you so much for taking the time to join us. We do appreciate it.
My pleasure. Be safe.